How will you know someone has hepatitis B infection? We are talking about the signs and symptoms of hepatitis B infection. Remember, at the beginning of the series, I made mention of hepatitis, and so it will be very difficult to just use some of these signs and symptoms to point to somebody and say you have hepatitis B infection, unless the person undergoes some form of testing, which has to do with testing for the surface antigen for hepatitis B infection. People have lived years with hepatitis B without showing even a single sign and symptom, and they are very fine. And so these are the dynamics with hepatitis B infection. At the acute phase, I mentioned in the previous video, and chronic stage. So at the acute phase, majority of people don't even show any sign and symptom. Some may just show sign and symptom which are not very specific to hepatitis B infection. It could mean any other infection. Some of them have to do with body weakness, like having loss of appetite. These are basic and could relate to any other, infection. At the chronic stage, however, majority of people still don't show signs and symptoms. Like I said, people have lived with this. I know people have lived with this infection for more than 10 years, except that they are very cautious to do blood checks every 6 months or every year, and that's what is keeping them on track. When your liver is destroyed beyond at a certain level, these signs and symptoms may manifest. We have jaundice, yellowing of the eye, and once there's jaundice, it usually manifests with what? Itching of your skin. We also have lower right quadrant abdominal pain, where your liver is located. You could occasionally feel pain around that side. It doesn't mean any pain felt there has to do with hepatitis B. That's what I'm saying. You could do further checks to check up on some of these things. At the extreme ends, people develop what we call ascites. Their abdominal wall becomes too big, not the pot belly type, but one which looks shiny. That shows that there have been accumulation of fluid in the peritoneal cavity, that is in the abdomen within. People also develop what we call edema of the feet. Their feet become swollen because the liver loses that function of controlling fluid seepage into body tissues. And these are some of the things that could happen at the very chronic stages. So jaundice manifests in the eyes, it could also manifest in the urine, and because there is no bile or excessive bile production and others, it manifests in the stool as well, your feces. These are not specific to only hepatitis B. It relates to all liver conditions. That's what I'm saying. You need to test to be sure it is viral hepatitis B before you can conclude. So these are some of the signs and symptoms of hepatitis B infection.